Hello and welcome to On the Record. I'm your host, Jerome Sawyer. We have now reached the inevitable. After several weeks of no new COVID-19 cases, the second surge is upon us. Just this week, Prime Minister Minnis announced a laundry list of new COVID fighting measures, namely the closing of our borders to all U.S. commercial traffic, a complete 2-week shutdown of Grand Bahama, and the postponement of national examinations. With a record-breaking 21 new cases in one day, Family Islands as far away as Cat Island and the Berry Islands now being affected, the insurmountable increase of infections in Grand Bahama, and the second postponement of national exams, it is quite clear that we have a potential crisis on our hands. Tonight, we focus on the second city and all Grand Bahama as we discuss COVID-19, Grand Bahama's second surge. Don't go anywhere. Our discussions begin on the other side of this break. The project really pays itself back.
Correct.
They set up
at the conference, the school.
As a journalist, I always have to focus on the facts, and sometimes that means going to investigate for myself. On the Record, Thursdays at 8 p.m. right here on RTV.
And welcome back. You're watching On the Record. Our topic tonight is COVID-19, Grand Bahama's second surge. I'm your host, Jerome Sawyer. Tonight, we talk to the heads of several agencies in Grand Bahama in an attempt to understand the situation on the ground there. The cases in Grand Bahama have exploded, and for now, it seems those numbers could continue to climb as testing increases. From the onset of the Emergency Powers Act, the Royal Bahamas Police Force has been tasked with a gigantic responsibility of ensuring that curfews, lockdowns, and business closures are enforced. The police force has reiterated that they not only have the capacity, but they are ready to enforce the law. With Grand Bahama now under a 2-week mandatory lockdown, we begin with Superintendent Teresita Pinder. Welcome to On the Record. I want to talk a little bit about what your role has been, particularly in the past few days in preparing for this lockdown.
Our task is, as stated before, we are on a lockdown. And what we have been doing, Assistant Commissioner Mr. Greenslade and his team, we have been going throughout the community, and we've been speaking to a lot of business persons. We've been communicating with the public. We've been educating the public and our officers on making plans for strategic patrols, mobile patrols, static point check in regard to the lockdown. Grand Bahama is ready. All persons are mindful of what is expected of them, and they seem to be very cooperative in this venture.
Okay, I'd like to explore a little bit about the response thus far. You're going in now to 2 weeks where people are really going to be under lock and key, for lack of a better term. But, what has been the response? We would have come through this as a country. We would have seen, an easing of a lot of the restrictions, but now back into a lockdown for this community now for 2 weeks. What's been the response that you've been getting from people?
Jerome, bear in mind, Grand Bahama, we've been through a lot. We've been through economic downfall. We've been through Hurricane Dorian. Now we're in COVID-19. Grand Bahama citizenry is very strong. They know what is required of them. And for the most part, the residents, they welcome it. They know what is expected of them. They know the reason why it was done by the Prime Minister. It's for all of our benefits, So we haven't had any resistance in regards to any persons in regards to the lockdown.
Now, we know that over the past few days, people have really been out trying to get their last minute supplies, essentials. Have you had issues at all with people social distancing and wearing masks? We know that coming down to a lockdown, people get very anxious. There are long lines, there are waits. You know, that right there, that's the potential for even more spread. Have people been complying with the orders in that respect?
Yes, Jerome. Case in point, cost right. Cost right. That very next morning, they put things in place in regard to the number system. They've been everything was in order. There were points made on the outside in regards to social distancing, and so far, all of the food stores were complying. Mind you, the first time we had the more or less the stringent restrictions in regards to COVID-19, persons learned from that. And as a result of that, they now know what to do. And they've been doing it. All small food stores, business places, they've all had things already, plans already in place, whereas they already had these mechanisms in place, and whereas there's a more smoother transition, and persons knew what is expected of them. So for the most part, all business places were in compliance.
Now, we would have gotten reports. These are just some things that would have been coming to me that, you know, prior to this, you had a lot of people gathering at some popular spots on the island. They weren't wearing masks. They were crowded together. What were the police out trying to deal with that as these things were happening? I mean, at this point, you know, we're not going to get into the blame game, but, you know, there has to be some responsibility somewhere. But you know, were you challenged with that? Were people out and not practicing the things that they should have been, you know, during the relaxation of a lot of these measures?
Jerome, I'll be quite honest with you. We had persons who were not in compliance in regards to wearing the face mask and the social distancing. What my Pacific Commission Secretary did was that we noticed the hotspots where all persons gathered, such as the fish fries and the local bars. So what we've been doing, all different divisions in their respective areas, they had officers in place in regards to making sure or ensuring that all the business places were in compliance, and those fish fry, as you so put it, they had patrols and officers on point duties to those areas, making sure that the point of time that they were supposed to close down, they closed down. Yes, they were a challenge to us, but we met that challenge, Jerome.
Grand Bahama is always so very unique to me because you've got a city as well as you've got settlements on the island. What makes policing this island, particularly at a time like this, difficult or unique for you?
It's not really difficult, Jerome. Bear in mind that most of Grand Bahamians are very law-abiding citizens. You just have that small pocket of persons who seem to want to push back, recognize who they are, recognize the places that's going to give us problems, and we deal with it. So for the most part, everything has been smooth so far for the most part, and we expect it to continue.
What what do what do you see as some of the biggest challenges that you're going to face over the next 2 weeks? We know we have some experiences in the past with people breaking curfews and things like that. What are some of the things that you are anticipating that you're going to have to deal with? And what kind of strain is this going to place on your manpower, resources, etc.?
But Jerome, bearing in mind this is the second, more or less, sprout in which we're entering, you learn from the first. So we put some things in place to avoid all those matters that may have occurred the first time. We know the areas that are of concern, so we put strategic plan in place to combat those problems. We don't anticipate any problems going forward. Bear in mind also, Jerome, that the manpower of the Royal Bahamas Police Force in Grand Bahama is still strong. We've always been resilient in any challenges we've been faced with. We've been through a lot, Jerome, and that has only made us stronger. I believe that the citizenry, along with the Royal Bahamas Police Force, coming together to work together, we're strong. and we could combat this and overcome this at the same time.
What about the vulnerable in the community? Part of policing involves not just the enforcement, but even being there for those who need help. Are you going to really be focused on those people, the vulnerable, the elderly, the disabled, the indigent, who cannot get out and may need some kind of assistance, whether it be emergency or just community assistance?
Yes, Jerome, we have our command center here. It's already set up and running. We are in constant communication with social services. We're in constant communication with the court system. We are in constant communication with all of our elderly facilities that if they should need any assistance with police officers, we are always here and available.
And the enforcement of the mask has been a nationwide issue. We've had issues here in New Providence, but what is your hard stance on that for people who, for whatever reason, don't wear them properly or will not wear them? What's the hard and fast stance on that?
Jerome, ever since the Prime Minister made this order, I have seen a big change in the attitude towards the mask, and I've seen people just wearing them without even being asked. They have all donned their mask. I think they see the urgency. They understand what's going on. We haven't had a challenge in regards to that so far, thank God.
I've got to ask you this before we go. Do you think the people of Grand Bahama really realize the seriousness of the situation that they're facing right now?
Yes, sir. Yes, sir. I believe they do. I really believe they do.
Okay. Well, we want to thank you for coming on and speaking with us today. I know that you all have a tremendous job ahead of you. The next 2 weeks, by no stretch of the imagination, are going to be very difficult for you. But certainly, thank you for sharing your plans with us. And hopefully, your job is not going to be too hard in enforcement.
We're here for the challenge. And I believe that we'll come through this with the challenge. Thank you so much.
Thank you very much and all the best to you. When we come back, we talk to a representative of social services in Grand Bahama. Don't go away. We'll be right back. Welcome to On the Record.
Looking for more On the Record? If you miss our Thursday showing at 8 p.m., join us for the re-airing on Friday mornings at 10, and then again each Sunday night at 8:30. Or go to our YouTube channel and catch up on all of our past episodes. And then like our Facebook and Instagram pages for a preview of upcoming shows and get a chance to ask your questions. Just look for On the Record.
Watching On the Record, this segment is made possible by Executive Printers. During his statement on Grand Bahama Tuesday past, Prime Minister Minnis assured residents of Grand Bahama that there are adequate food supplies on the island at all of the food stores. He reported the National Food Distribution Task Force, Grand Bahama Food Distribution Centers and NGOs will be distributing food. He also announced that the National Food Distribution Task Force and the Department of Social Services are making arrangements to ensure that food needs will be met during the lockdown, and it is anticipated that food vouchers will be distributed to some 14,000 residents. My guest for this segment of the show is Carla McFernander. She's the Assistant Director with responsibility for the Northern Bahamas District at the Ministry of Social Services. Thank you for joining us On the Record. I want to talk about what has it been like from a social services perspective, first having to deal with Dorian and now the COVID-19 pandemic, considering you all are about to go into your second lockdown.
Well, we've certainly been challenged with an influx of persons applying for various forms of assistance. In relation to Hurricane Dorian, there's been a request, increased request for food assistance, and then persons have been requesting assistance with replacing appliances and basic furnishings like beds. So that has not abated since Hurricane Dorian, and the incidence of the COVID-19 pandemic has, of course, exacerbated that situation. So on a daily basis, we see large numbers of clients coming in for assistance.
What kinds of things are people coming for? Particularly, I mean, a hurricane situation, obviously, you lose possessions, etc. But, since we've been through these lockdowns, what are the types of things that people have been needing help with, taking into consideration even those who have lost jobs?
Most people have been coming for assistance with rent, where they have lost their jobs, they may have lost their housing, and they come for assistance with rent with new places or to pay rent at their current addresses where they're not able to afford to pay the rent. And of course, on a daily basis, they're coming for food assistance.
Now, I want to talk about the next 2 weeks. What kinds of things will you be really focused on and helping folks out with during the next few weeks as they are in this lockdown phase?
Well, of course, the Department of Social Services partners with the National Feeding Program. And so we'd like to get the word out there to the general public that if you are receiving assistance through the National Feeding Program, there's no need to come to social services. In fact, persons are not allowed to double dip. They would get the assistance through the feeding program. Now we have our regular clients who are in possession of debit cards or they get monthly food coupons because they are approved for long-term programs. And those persons will continue to be assisted through those programs. New persons will, of course, receive assistance through the National Feeding Program. And if they have not, for whatever reason, registered, those persons then must come to our offices in the Sun Plaza on West Settlers Way in Freeport or at our 8 Mile Rock office. And they can request assistance and be assisted in that way.
Are you
I'd also like to mention.
Go ahead.
I'd also like to mention our hotline numbers that they can call 727-2477. And persons are encouraged to apply for assistance through our site, Social Services App, that's APP, at bahamas.gov.bs.
Are you satisfied that you all pretty much have been in contact with those that need help? Have you been able to reach the people and have they been able to reach you? Are you pretty satisfied that you've been able to reach out to them or are in contact with those that really need help?
I think for the most part, persons are coming for assistance because we see them 100 to 150 persons every day. And it would appear to me that they are able to reach us. They come here. I'd like to add our telephone contact is 352-9851 or 2. I mentioned the hotline 727-2477 or via the website. Now, if anybody is aware of a person out there who hasn't been able to get any kind of assistance, please reach out to us and we will respond promptly.
What about those in the community that are really disadvantaged? You're elderly, you're disabled, you're indigent, those who are really at risk. Any special provisions for those folks?
We accommodate them as well. And also we are quite willing and able to go out to people once persons are referred to us. We get many referrals via emails or the internet. Anybody who's aware of someone like that, as you described, elderly or persons with disabilities, please bring them to our attention. If they're not able to come here, we will go to them.
Describe the relationship between the ministry, the feeding program, and the NGOs. How do you all work together?
Well, the ministry provides, I think, some 85% of the funding for the feeding program, which is why, we discourage persons from double dipping by going to the feeding program and then coming here to social services. So that would mean that we are providing for them twice. And the NGOs, I think they provide some 15% of the funding for the feeding program. And so what we're doing is we are cross-referencing persons who apply for either program so that we can make sure we reach the greatest number of persons who are genuinely in need. So there's an exchange of information between the feeding program and the Department of Social Services to make sure we cover those who are truly in need of food.
Now, social services obviously in this instance is, I guess, predominantly focused on ensuring that people just have some necessities to get through this and whatever hardships come their way. But you deal with so many other things. You've got, people who are abused and facing other issues. How are you striking that balance with keeping an eye on those things and those folks who need help in other areas as well, particularly abuse, as people are locked down and probably finding themselves in situations that are not ideal or in situations where they're at risk?
We'd like the public to know that we never stop rendering assistance for all of our programs. We are particularly concerned about persons who are shut in or have disabilities, senior citizens, and most definitely our children, because the incidences of abuse tend to rise in situations such as this. Persons are subjected to domestic violence, etc. So I'd like the public to know that we are continuing assistance in all of our programs. And so we are here every day. We are an essential service. I think sometimes that gets left out when they're listing essential services. But we are an essential service. We're here from actually before 9 until 5 p.m. every weekday. And of course, we have the hotline, which is the 24-hour hotline, 727-2477.
I've got to ask, have you had to rescue any folks or remove children or anything during this period? Have you had to gone in and had any interventions?
Yes, we've had to.
And what happens in an instance like that?
We send officers out to investigate, to verify if there is a cause for concern. And if we find it necessary to remove children, we do so. Even though right now the grandfather children are not soon. But even though that is the case, we find alternative places to get care of it. And this is a safe place. So we must intervene anyway.
Well, that's comforting to know that if people need help, even at a time like now, you are available to intervene and to help. What about those institutions, organizations that do want to help? Even those that are here in Nassau, a lot of times, there are groups that want to help. This is going to be a very tough time for Grand Bahama. All things considered, it has been, a really difficult time for you all, not just this year, but this is, sort of ongoing. But those organizations and individuals that want to help, that have something to assist, how are they able to help? And what kinds of things do people need the most?
In terms of how they can help, I would invite those organizations to reach out to the ministry on its website, or they can actually email any of us. I'm hoping that you'll be able to run my email address on your screen, as well as our hotline numbers at some point during this program or sometime thereafter. So they can reach out to us and liaise with us in regards to what they're able to provide and what persons are in need of. There are persons who have not recovered from Hurricane Dorian. They need everything from appliances and bedding straight around to, I suppose, building materials. They need food assistance. They need basics. And very soon, schools will open. And that is where we will launch our National Uniform Assistance Program. So we're still going to put that program on in the next week or two. We'll get started with that. Well, after this lockdown, we'll get started with that program as well.
Mm-hmm. It's so important that you said that, because I think sometimes we forget that, or we overlook the fact that you all are still recovering from a hurricane, and the needs are so great still, and that you are still in need of all of these things. Have you been able to meet the needs is really the question, on the minds of so many people, because the needs are so great. Have you been able to meet those needs?
I know it's challenging meeting the needs of persons, and I would not be so bold as to say every single need has been met. I'm sure that's not the case, but I do believe that we have addressed many needs. Many persons have benefited. In terms of human nature, you just tend to hear about persons who are unhappy or things haven't gone smoothly in meeting their needs. But the vast majority of people who have approached us have had their needs met. It's just that you don't hear from them again. And perhaps that's a good thing. That means they're okay. But I think we've been able to do meet quite a bit of needs, although there are some that still need to be addressed.
Charlemagne Fernanda, I want to thank you for taking time out and speaking with us this morning. I applaud you for the work that you and the folks at Social Services are doing. It cannot be an easy job. And as you mentioned, you know, the needs are so great. They don't stop. They have not stopped. And we certainly will provide that. I've been providing that information where people can offer assistance and render assistance to the folks on the island that need help. Thank you so much. All the best. Continue to stay safe and continue to do the great work that you and the folks on Social Services are doing on the island, as well as to the NGOs and those involved in the National Food Distribution Program. We applaud you and thank you for the work that you're doing. When we come back, we talk to the head of the COVID-19 task force on the island, as well as the minister with responsibility for Grand Bahama. You're watching On the Record. We're back right after this. Hello and welcome to On the Record, and the balanced, true and open debate you've been looking for. Welcome back. You're watching On the Record. Tonight we're discussing COVID-19's second surge, particularly in Grand Bahama. I'm your host, Jerome Sawyer, and this segment is brought to you by the Grand Bahama Power Company. My guest tonight, as we continue our discussions on Grand Bahama and its most recent outbreak, is the head of the COVID-19 task force on the island, Dr. Frank Bartlett. Now, during his statement on Grand Bahama Tuesday, the Prime Minister had a few things to say about Grand Bahama and what we must do to control the spread of the virus.
After a little more than 2 months without recording any new cases of COVID-19, Grand Bahama has recently seen a significant increase in cases. The island has been classified as a COVID-19 hotspot by health officials. As of Monday, the 20th of July, health officials have confirmed a total of 59 cases of COVID-19 on Grand Bahama. 51 of those cases have been recorded since the borders fully reopened on July 1st of this year. Outside of New Providence, Grand Bahama now has the largest number of recorded cases in the Bahamas. The number of confirmed cases is expected to increase if much of the population continues to fail to practice recommendations for physical distancing, wearing protective face coverings, and frequent and thorough hand washing.
And since the Prime Minister's remarks, those numbers have increased daily. Dr. Frank Bartlett is joining us from Grand Bahama. Dr. Bartlett, I've got to ask the question, I think that's on the minds of so many Bahamians. What happened? There were weeks where, you know, there were no new cases, and all of a sudden, 2 weeks after the borders opened, and we've spiked again. What has happened from your estimation?
Several things happened. One is that we relaxed some of the restrictions as it relates to movements of the community, persons in the community. The second is that we opened our borders to persons coming in from areas that we were known to have COVID-19 cases. So those two, along with other factors, are what we see mostly being responsible for what we're seeing now in Grand Bahama.
In terms of being able to contact trace, are you able to tell us how many of those individuals who have tested positive would have traveled? Is there a percentage? And of those who would have traveled, what contact would they have had that would have related in even more people being infected?
As it stands today, we have identified some 4 persons that have clear links to international travel. We also have identified 2 persons who have had travel in other islands or within the Bahamas. Now, we have a definite link of one of our international travelers basically returning, and having direct contact with other persons who have tested positive subsequently. And within that grouping alone, we have some 9 to 10 persons being affected by that case that came in from the United States.
Are you able to also, is there a direct correlation for people not following the proper guidelines and rules? I mean, once we started to move through the phases, a lot of things started to relax. I think people just generally took some things for granted. In your estimation and in the estimation of the medical professionals, did we become too lax and did we stop abiding by the things that kept us safe in the beginning?
The short answer is yes. We would have noticed even when the first announcements of the relaxations began within our community, we saw less people complying with the mask. The establishment did a pretty good job in the sense that they were enforcing the adherence to social distancing. They were enforcing the adherence to wearing masks within the establishment, but if you walked out into the general community, you would have seen a lot of persons not wearing the mask at all. So that is one of the things that are directly related to it. The important factor to remember about this now is the mere fact that masks do work. And that's the message we've been trying to get to the community since we had evidence that the masks did work. And it's a single most effective means of mitigating the spread that we're seeing now.
Dr. Bonnet, my next question has to do with the capacity to manage all of this. I do know that health officials are on the island helping to contact trace, helping to test. We had an incident this week where we weren't able to get the dashboard until almost midnight, calling into question our ability to manage all of this. And numbers are spiking daily. Are you able to manage all of this that's happening? It's stretching resources. Give us an idea really of your ability to really keep all of this, manage all of this as it's happening.
Our ability to manage is we are challenged with resources. That's the first thing to be able to understand. One of the things that we would have benefited from was the fact that the Ministry of Health would have sent a team over to augment the staff that we do have in place. The exercise that we have as it relates to contact tracing is very, very labor intensive. It involves not only discussing cases and going through things on the phone with the persons and the contacts, but it also means getting out there and beating the pavement and actually having discussions, doing evaluations and doing assessments. If you look at the response to persons who use the method in different countries as it relates to contact tracing, there are challenges because as we know, it is referred to as a draconian method, but we have only that in our government to do what we need to be done, needs to be done in order to contain and to mitigate what we're experiencing now in the surge of COVID-19 in Grand Bahama.
What is the most difficult part in all of this? Is it the testing? And, following up on that, are you able to confirm how many tests you have done or how is testing being done? What's the biggest challenge right now that you have on island?
The biggest challenge for us now is the sheer volume that we're having. Okay, the testing capacity as of yesterday, or the amount of tests that we have done, would have been some 433 tests. You have to be able to understand since Friday of last week, Monday, that's a period of 4 days, we would have sent over 125 tests from Grand Bahama. On average, we're sending a minimum of 18 tests to 24 tests on a daily basis. Challenges we have with that is that we have to have the testing transferred to Nassau. When it arrived, we had to set up. And so with those logistical issues that we have to factor in, there is obviously going to be some delay in the test results that we're seeing here at this point in time.
Do you think you will get to the point where you will have mass testing on the island? I know, and this is from my own experience, usually a test will be initiated for a number of reasons, whether the person is showing symptoms or, there is need to, you may suspect that they do have a case. Is that going to change? Are we going to get to the point where you're going to be doing more mass testing?
I wouldn't necessarily use the term mass, and to be very clear what we mean by mass testing. Mass testing for the greater good basically means that we take a random population, we have them come and we swab them, we get the results, and we have numbers actually generated. Our approach, based on the experience we've had with testing capacity and thinking forward and looking to what's going to be happening possibly in September with another surge possibly of the coronavirus, we have to be targeting our groups to test. So what we have done in this instance now, I would use use the phrase expanded testing as opposed to being mass testing.
We don't seem to be seeing the high number of hospitalizations this time around that we would have seen the last time. I know we do have some people hospitalized. Is that actually the case, or am I misreading what I'm seeing?
No, we're seeing not an increase in hospitalization as it relates to the COVID-19 cases that we have in Grand Bahama. In the past, and at least in the instance of now, in the time of now, we have most of our cases are symptomatic and can be asymptomatic, sorry, or have mild symptoms and can be managed and monitored at home. We've been fortunate in the sense that the cases that are hospitalized, the majority of them have a turnaround period of anywhere from 3 to 5 days. The more severely ill are the ones who come into the hospital in moderate to severe distress or with moderate to severe disease. Their extended stays usually goes out to as much as 7 days. So we've been very, very fortunate in the sense that our cohorts here have mostly had mild symptoms, and we've had a few cases that would have necessitated prolonged hospitalizations.
And very quickly before we go, I know that there were several facilities that were opened and available for care during the first surge. Are those facilities still open and available and still operational?
Those facilities are still open, they're still available. The two groups in which we have housed at those facilities are those who need isolation, who don't have the means to quarantine at home, and any other persons basically who would identify who may be a risk to the community, a suspect case of COVID-19, they are housed in that quarantine center. So in that center, we usually house isolated patients, that means persons who are tested positive, and we also have persons investigations who have
Dr. Bartlett, thank you very much for taking time out to speak with us today. We do appreciate it. I know that you all have quite a yeoman's task ahead of you, but we appreciate the work that you're doing. Thank you so much. We certainly will be talking with you in the future. Once this 2 weeks is up, we hope that things have settled there considerably. Thank you so very much. When we come back, we continue our conversation with the minister responsible for the island of Grand Bahama, Senator the Honourable Kwesi Thompson. Don't go anywhere. Our final segment is up next. Hello and welcome to On the Record, and the balanced, true and open debate you've been looking for. And welcome back. This is our final segment tonight. As we end our conversation on the COVID-19 second surge, looking specifically at Grand Bahama, I'm joined by the Minister of State for that island, Senator the Honourable Kwesi Thompson. Minister, let's first of all talk about what you want to achieve in these 2 weeks, and are you ready? You've had just about 2 days to get ready. Are the people of Grand Bahama ready for this lockdown? And secondly, what do you want to achieve?
So residents really have been preparing. Residents have been stocking up at the food stores. I've seen them at the gas stations. They have really been taking this very seriously. And yes, I believe for the most part, residents are going to be ready. Just recall also that although this is going to be a lockdown, one of the most important things of this lockdown really is that essential services are still going to be open. Persons are still going to be able to get groceries on a limited basis. They're going to be able to go to the gas station sort of in emergency purposes. But yes, they have been preparing. Secondly, what we really want to achieve is to control the spread of this virus. We completely agree, and I believe most of the residents of Grand Bahama agree with the decisive, tough, but necessary action that the Prime Minister made in doing this lockdown and in doing this lockdown at the time that he did. So we really want to have and to contain the spread of this, and we think that the best way of doing it really is for us to have a lockdown to ensure residents stay home, to ensure that they are going to abide by the necessary social distancing, we're really facing a very, very serious situation in Grand Bahama. So this lockdown was absolutely necessary.
You would have mentioned the essential workers who will be allowed to move around. In several quarters, the issue has come up. It seemed like the list of essential workers or those who are exempt seems very long. Is that the same? Are those the same individuals who were exempt the last time, or have more people been added to it? And if so, why?
So this is actually the same list. In fact, it's less than were exempted the last occasion. One of the things, and let's just look at this from a category point of view. Obviously included in the list are the government essential workers, the police, the defense force, persons like social services, immigration. Obviously they are necessary for emergency situations. Secondly, you're going to see things like the food stores, the pharmacies, gas stations. They are also necessary for persons in emergency services who are going to be locked down for the 2 weeks. We've also seen, and I know what may have raised eyebrows, but anyone from Grand Bahama would have understood that the industrial companies have been exempted. They were previously exempted. The reality is our industrial community is large here in Grand Bahama. We're really the industrial capital of the Bahamas. And a number of these large corporations and large industrial companies have very, very volatile, dangerous equipment that you just cannot shut off with a switch. In fact, most of these companies have, when there's a hurricane, they have hurricane personnel who remains on site just to ensure that the equipment is maintained, to ensure that it is safely maintained. For example, you have the pharmaceutical company like Pharmachem. You have another company like Polymers. You have the oil storage facilities at Buckeye and Equinor. And then you have a number of these companies support those industrial companies. And the second point I want to make with respect to that is they are not open to the public. They are open for the purpose of maintaining their equipment, and they are also open for the purpose of emergency situations and emergency operations on site. You also have places like the shipyard. And the shipyard, as you know, has probably about 1,000 employees with very, very large vessels, very, very large machinery that really is needed to at least someone to keep those machinery safe, to keep them in operating conditions. So that's really what the purpose is. It's no more. In fact, it's less than what was done before. So it's no need really for people to be concerned with respect to that. And they are not open to the public. So the public is not able just to show up at these facilities and have some sort of service. They are not at all open to the public.
Thank you very much for clarifying that. It would seem, sir, and this is just, from a layman's perspective, that we let our guard down. We didn't continue to do the things that kept us safe in the beginning. Once we get through this, and we have to always keep in mind that we are going to get through it, what is going to be done differently? Where I said, I said to myself, and I said to quite a few folks, I don't think that we are continuing to push the message enough as we reopened. What is going to be done differently this time around?
So, I can say a couple of things to that. One is, COVID is going to be with us. I think until we get a vaccine, and I think that message has to continue to be pushed to our residents. Without a doubt, we cannot be relaxed with respect to pushing this message that it is with us. It is not going to leave us until we get that vaccine. So you must continue to have those social distancing measures. In my own observation, when Grand Bahamians saw that our numbers had gone down, we had not had a case for 60 days. We saw persons out and about without wearing masks. We saw persons who were out and about visiting families and were not practicing that social distancing. We saw people crowding in the places like Port Lucaya, crowding at Fish Fry and these other places. And unfortunately, I don't think that they observe the necessary social distancing protocols. So I think one thing we have to continue to press, and we have to continue to educate, we have to continue to remind that this COVID is with us, and we have to continue to have that social distancing. Now, let me also say that the majority of Grand Bahamians are doing well with respect to practicing social distancing. The majority of Grand Bahamians continue to wear their masks. They continue to practice the necessary social distancing when they go to churches and these other facilities. The majority of Grand Bahamians have done that. But it obviously was not enough. And so we must continue to press that. I think we must also continue when it comes to traveling back and forward. I think that point has to be made.
I'm happy you brought that up. I want to stick a pin right. That's the elephant in the room I want to get to. I'm telling you my personal experience. I was in Grand Bahama a couple of weeks ago shooting for this very show, looking at, post Hurricane Dorian. I was shocked when I saw the Bahamas Air flight come in from Fort Lauderdale and the amount of Grand Bahamians that disembarked that plane coming from Fort. That shocked me. That was one. And I know also, too, that there is a propensity for people to use the boat to go to Florida to shop.
Yeah.
How are we going to address that? I mean, what do we need to say to our people to get them to understand the seriousness of this? And in fact, that you would have gone and brought a virus back into your community.
So, the Parliament met today, and in fact, this very issue was addressed by the Prime Minister, that we are going to have to look at some very, very serious questions with respect to Bahamians and their travel and Bahamians and return. And at the moment, I don't have an answer for it. However, it is an answer that we are going to have to resolve, and collectively as a government, we are going to have to be able to answer, because it is a serious situation, especially given the circumstances that most Bahamians will travel to Florida, and Florida at the moment is at the center of the United States COVID situation. So we will have some very tough decisions to make, and we have to make them very quickly. So I know that at present, the cabinet is going to be meeting on these kinds of questions, and we're going to have to come up with a balanced solution with respect to these questions. But you're absolutely right. That is the elephant in the room with respect to how we manage Bahamians when they travel and when they come back.
And what restrictions we place on them upon their return and things of that nature. I mean, it's one thing to go, but when you come back, we've got to take a serious look at that. Sir, I've also got to ask you this question. I asked it of Dr. Bartlett in the last segment, but do you have the resources that you need? The test kits that you need, the personnel that you need, the help that you need. Do you have enough on Grand Bahama as we speak?
You have countries all over the world who are challenged and who are stretched. And there really is no difference between us and them. We are stretched, we are challenged. Given the situation that you have 20 cases in one day, which is really the largest number of cases that we've seen, not just in one island, but it's actually the largest number of cases that you've seen in the Bahamas at any one time. We're thankful that the Ministry of Health has brought in support to help the team here in Grand Bahama. Our office here at the Office of the Prime Minister has been able to provide some support for them as well during this period of time, but they're stretched. And I want to congratulate really that health team in Grand Bahama, because they've been working almost 12-hour, round-the-clock shifts. Dr. Bartlett and his team, they've really been doing the best that they possibly can. They are moving from the harbor to businesses to the hospital, and they're doing contact tracing. So I commend them, but obviously we are stretched.
Minister, I've got to ask about, those communities that are so near and dear to me. I've got to ask about 8 Mile Rock and West End and East End and Sweetings Key and those outlying communities. We always talk about Freeport as a second city, but I always remind people that Grand Bahama is an island made up of so much more than Freeport. How are the folks in those smaller communities, those historic but very important communities as well?
Well, obviously, West End is challenged. That's one of the, if you could call it a hotspot within a hotspot. West End is challenged. There are a number of cases being managed in West End. 8 Mile Rock, the same. There are a number of cases being managed in 8 Mile Rock as well. And so the health team has spent a significant amount of time in West End, a significant amount of time in 8 Mile Rock as well. Sweetings Key, thankfully, we haven't had much of a challenge with the COVID in Sweetings Key or really in East End. But there are a significant amount of cases in the Freeport area, 8 Mile Rock, and West End. But again, the health team is doing the best that they possibly can with managing in these different locations.
Minister, I want to thank you for taking the time to come on to speak with us. Whenever we think that we are at the, we see the light at the end of the tunnel, there's another bleep in the road.
Yeah.
But I have to tell you that, I commend the people of Grand Bahama for the resiliency, not just for this, but for so many other things that you all have had to deal with, this year, last year, and in previous years, but yet still you keep going. And it's an encouragement to the rest of us.
And Jerome, if I can very quickly also add to that, you're absolutely right. And we want to just continue to encourage the people of Grand Bahama. They are tough. They're resilient. As I said many occasions, they provide me with the motivation that I need every day to get up and to continue to fight. They are fighters. They fought through Dorian. They fought through a difficult economy, and they continue to be positive in this. And so they are going to get through this. As I've said, we've gotten through this COVID before. We will get through it again with the grace of God. And I know that Grand Bahamians, like other Bahamians, trust in God, and they trust that He's going to see us through. And it's one of those sayings that the more difficult the situation is, the better the blessing is on the other side. And so we in Grand Bahama expect that we can have double for our trouble. But on a serious note, they are really resilient. They are going to continue to fight, and we just want to say thank you for recognizing that.
Thank you very much, Minister. Keep safe, those around you and throughout the island. Thank you very much for joining us tonight and giving us some insight to the people of Grand Bahama. Over these next few weeks, we certainly will be keeping you on radar and keeping up to date with what's happening on the island. We encourage you to continue to follow all of the protocols. These things are put in place for our safety. We have been able to overcome this in the past as a nation, and we certainly will be able to do it again. I know and I trust that everybody will continue to keep safe. So thank you very much. That's going to do it for tonight's episode of On the Record, looking at the COVID-19 second surge, particularly in Grand Bahama. Special thanks to all my guests, Teresita Pinder, Charlemagne Fernanda, Dr. Frank Bartlett, and Minister Kwesi Thompson. Special thanks goes out to my production and technical teams for making this show possible, and of course to you, our viewers. We certainly couldn't do it without you. Remember to stay up to date with the latest news and information on this network, Our News Nightly and Our News Bahamas on Facebook. See you next time, same place, same time, right here on The Record.